Welcome to Ask MSVIA, where we answer your most common insurance questions clearly, quickly, and without the jargon. Let's get into today's topic.
Hi, I have a question for you. Can you tell me a little bit about vicarious liability?
Vicarious liability is a legal concept where one party is held liable for the actions of another party.
Okay, so how does that kind of work in the healthcare space? So I'm a doctor, and how does that affect me in my practice?
So a really common example with a medical practice is a doctor can be held responsible for the actions of an employee, like a nurse or an NP or a PA.
Oh, wow. So even if their license is under my license, I could be held responsible for medical errors.
That's correct.
So can you tell me how we can kind of protect ourselves from that and what is best practices?
So it depends on the type of employee. So in a medical malpractice policy, the RNs and techs, those folks are contemplated as working for the medical practice, and their liability is covered. Higher level people like NPs, PAs, physicians need to be named on the policy.
Okay.
So that's something you need to look for.
Okay, so basically the NPs in my practice would need to be on our medical malpractice insurance.
Most of the time, yes.
Okay, interesting. So what should I be looking out for in that type of coverage, and kind of what questions should I be asking when I'm shopping?
So your agent can help you look at your insurance policy. All policies are a little different. We're going to look at the policy language and see what's required under the policy. Sometimes you need to name all of those individuals. Sometimes they are covered under a blanket.
Okay, and so I would need to ask my insurance company
Correct.
about what's covered. So if I am a new physician and I'm opening my practice, for example, and I am hiring a few NPs and my nurses and fellow doctors, and I have to kind of start from scratch, what would kind of be my first step in kind of making sure that I've covered my bases and also protected my employees and patients?
Call your insurance agent and talk about your plans. We can't help you if we don't know about it.
Okay. And can you give me, as a new doctor in a new practice, some kind of risk management tips and things that I should be following for, vicarious liability and things like that?
Making sure you have a contract in place of what each person's responsibilities are and what's expected of them. Making sure you understand how your insurance policy works. Don't make any assumptions. Make sure you get it cleared with your broker and you understand everything. Get a certificate of insurance that names anybody else.
Okay. Can you tell me a little bit about if I hire an independent contractor and how that would work with vicarious liability?
So that one is a little trickier. A patient coming to see you, they don't know that independent contractor is not your employee. They just know they're coming to your office and they see your name on the door. So they're going to assume that person is your employee. If that person has their own separate insurance policy, you need to make sure it covers their work at your practice.
Okay. So can you give me an example of who would be a contracted employee in a healthcare space?
We see a lot of practices use independent contractors. They might have someone on house who looks at labs or reads radiology studies or something like that.
So it's kind of similar to how medical insurance, if the person who read my labs.
Or it can just be someone who's part-time.
Okay. Well, what are kind of the frequently asked questions that you get about vicarious liability? I know you and your team kind of handle all of the accounts at the MSVIA, and how do you guys kind of answer those and manage it?
We like to hear about them when the person is hired.
Okay.
And we can look into their policy because they're all different and look at how it works and what we need to do.
Okay. Do we need an endorsement on our policy?
You might. The company is going to want to know more information about the person and what they're doing and how much they're working for you and that sort of thing. It depends on the company. But just to be clear, when you do add an endorsement, the vicarious liability coverage is for your practice. It does not provide coverage for the person.
Okay. So for that person, they would still need their own policy.
Correct. If they're an independent contractor.
Okay. Great. Wait, before we continue, what is an endorsement?
It's a rider or an addendum onto your insurance policy that adds coverage for the exposure you need.
If I hire an independent contractor at my practice, do I need to update or change my policy?
Yes, you do. The insurance company is going to ask about what this person is doing, their name, their title, all that kind of stuff. There might be a charge for it, and they may add an endorsement onto your policy that gives coverage for the practice, not for the person, but in case the practice is sued for something that this independent contractor does.
Okay, and so the person would still need to have their own medical malpractice insurance. Okay. Well, thank you so much for talking with me today, Susan. If you have any questions or you want to learn more about our offerings, visit msvia.org. And we're so excited to have had this conversation.
Thank you, Taylor.
Thank you.
Thanks for tuning in to Ask MSVIA. For more resources or to speak with our team, visit msvia.org. See you next time.